Okay, good morning, everyone. I'm Jessica Lopez, Communications Coordinator here at United Ag, and welcome to our Health Chat session today, where we're exploring an exciting and impactful topic, evidence-based complementary and alternative medicine. And today, again, we have Dr. Rosemary Koo, who will share her insights on the various pros and cons of these practices and how they can enhance our overall health and well-being.
Great. Thank you so much, Jessica. First, I'd like to thank our sponsors, which include Cyene, Blue Shield of California, Single Point Insurance Services, and Elite Medical. And as Jessica mentioned today, we're going to be focusing on complementary and alternative medicine, which I'll refer to in shorthand during this presentation as CAM. We're going to barely touch the surface. I mean, this is a wide range of therapies that we're going to be talking about, but I'll try to give you some highlights and takeaways when you're thinking about exploring this area. We'll also discuss the clinical indications for what some of these therapies are best suited for. I'll go over some of the clinical evidence for these complementary medicines, also helpful tips and some educational resources so you can read more on your own. In addition, we'll leave plenty of time for Q&A at the end. I'm sure there's going to be a lot of questions here as I'm not going to be able to touch upon every single detailed therapy during the talk. So here are the most common CAM treatments out there. Mind-body practices include things like meditation, yoga, Tai Chi, or Qigong. And a lot of these are commonly thought of as exercise or something that you go to a yoga studio to do or a wellness retreat. But these can actually be important, really important parts of healing and really nicely add to more modern medicine treatments. Acupuncture is the insertion of thin needles along energy channels, also called meridians in traditional Chinese medicine. And although a lot of the concepts in traditional Chinese medicine, like kind of the heat and wetness and kind of all these other concepts, may not have corollaries in our modern Western medicine, acupuncture does seem to stimulate nerves in a way that can reduce pain and also impact the chemical balance in our bodies. So it's been shown to potentially increase endorphins, release some stress, and also balance some hormones. So while we don't totally understand how acupuncture works, there is a lot of evidence behind this, and it does seem to have a significant effect on people's health. And for those of you that might be afraid of needles, acupuncture doesn't typically hurt, and the needles aren't big enough to actually draw blood. Aromatherapy is often something is kind of thought of in pseudoscience, but it is actually a part of CAM. And essentially, aromatherapy is the inhalation of very dilute essential oils. And when you breathe in these essential oils, it can have an impact on your nervous system and brain. Herbal medicine is the practice of using herbs for therapeutic purposes instead of just purely culinary. Yes, absolutely, food is medicine, but in herbal medicine, the herbs are usually combined in a way or prepared in a way that's different than in food. And in chiropractic care, this is a hands-on therapy that many of you are probably familiar with. It's spinal manipulation to correct alignment. It's usually along the central spine. Occasionally, other joints are treated as well, but this is mostly used to impact the spine and improve joint function. Massage therapy is often thought of as kind of a luxury thing to do, but there's actually quite a bit of evidence around different types of massage. And there's a huge range of practices around here, ranging from Swedish, shiatsu, trigger point, lots of different massage therapies here. And then homeopathy, which I think actually is one of the types of CAM that actually give this whole category kind of a little bit of a negative connotation because homeopathy is one of those CAM treatments that has less evidence. And it has been based on a theory of like cures like. where it's thought that diseases can be cured by substances that cause similar symptoms in healthy people. So these are often substances that are thought of as toxins or poisons, but if they're dilute enough in the concept of homeopathy, they can actually be healing. And it's thought that the lower the dose, the more effective. And often these substances are made into sugar pellets or creams and ointments. And often they're diluted so extensively that the original substance is there in really microscopic amounts or not even at all. Again, this is one of the types of CAM that is actually has less strong evidence compared to all these others, but I do want to address it because it is something that people popularly do like to try. So next, I'm going to talk about the clinical indications for these common types of CAM treatments. So like modern medicine, where treatments are prescribed for specific illnesses, different CAM therapies are best suited for specific conditions or clinical indications here. So a lot of these therapies aren't necessarily things that impact your overall health or meant to be used for every condition out there, but they're actually best suited for specific conditions. For instance, in acupuncture, the way it has kind of integrated into Western medicine is that it's specifically used for chronic pain syndromes, including osteoarthritis, migraine or tension headaches, and low back pain. Those are the kind of the pain syndromes that acupuncture seems to be the most effective for. It's also been highly studied for nausea and vomiting, especially around chemo treatments and also after surgery. And so this is not necessarily the way acupuncture was intended to just be used for these clinical indications. So if you ever talk to a traditional Chinese medicine practitioner, acupuncture is really used for a whole slew of health conditions. And most of them will say that it can treat like almost any condition out there. But the way acupuncture has been applied in Western medicine is really focused on these conditions that I listed here. Chiropractic care, again, some practitioners say that chiropractic is great for everything and anything, but the way it's applied in our Western medicine is really to focus on low back pain, headaches, and also neck pain. Again, anything that's related to that central spine and alignment. Massage therapy is usually used for improving mental health, reducing anxiety, depression. It can also help with sleep as well as chronic pain. Herbal medicine has a wide range of clinical indication and is highly dependent on the specific herb. Mind-body practices have typically been used to target stress, also mental health like massage therapy, and also very interestingly has been shown to help with chronic condition management. And we'll talk a little bit more about that in a later slide. Aromatherapy has also been targeted towards stress reduction, mental health, pain, and sleep. And as I mentioned, homeopathy is highly controversial, and there seems to be a very significant placebo effect. And now for a little bit more detail on the amount of clinical evidence for CAM and the effectiveness. So this table here basically summarizes, I tried to kind of summarize the amount of research into low, medium, high, and then the effectiveness into low, medium, high based off of these different treatments. So for acupuncture, as I've mentioned, this is probably one of the most well-studied CAM modalities and has especially high clinical effectiveness for those pain syndromes and as well as nausea and vomiting. For chiropractic care, there's still a good amount of research. I'd say it's more medium and it's not as high as, say, acupuncture, but the demonstrative effectiveness is medium to high, specifically for that low back pain, headaches, and neck pain. For other joint pains, such as shoulder pain or knee pain, it has not been shown to be quite as effective there. Also, with chiropractic care, you do want to make sure that you're getting a licensed practitioner. Make sure you read reviews. If you can get a referral from someone you know, that would be the best. Because also, like with acupuncture and chiropractic care, the effectiveness of these treatments is highly dependent on the practitioner. And the person that you have, depending on their training and years of experience, can really impact your healing process with them. Massage therapy also actually has quite an amount of research associated with it, especially with Swedish massage, deep tissue, and also the sports medicine literature has a lot of research on massage therapy for healing after injuries and also with physical performance optimization. So there's a good amount of demonstrative effectiveness there. Massage therapy has also been shown to decrease levels of cortisol, which is your main stress hormone. It can also reduce muscle tension, inflammation, and even improve sleep and the immune system. So that makes that, spa day actually seem a whole lot more effective other than just kind of a luxurious experience. With herbal medicine, this is an area that there's a lot of interest in studying, and over the years, there has been more and more research developed here. And interestingly enough, the herbs are so in medicine we are so kind of sensitive to people using them that one of the first questions we ask someone is really what herbs are they taking, especially if we see a change in their blood pressure. And I can tell you during my training I've seen tons of patients that have actually started herbs that are either from this country or another country that had a big impact on their body's functioning. You would think that they were taking some sort of pharmaceutical, but it's actually an herb. And so a lot of these, even if it seems natural, can actually have a huge impact on your body. And for instance, one of the most highly researched herbs is St. John's wort, and it's been shown to be as effective as some of the antidepressants out there for mild to moderate depression. But of note here, and I'll emphasize this later as well, is St. John's wort actually has a lot of potential contraindications depending on your health conditions and medications that you're taking. So again, these herbs, although they seem natural, need to be treated as if they are medicine. Some other herbs that have also been studied a lot include biloba, which is an herb, or it's a supplement really that has been thought to improve cognitive functioning. The evidence on that is a little bit hit or miss, though. It's not necessarily been shown to delay or reduce dementia significantly, but there is a lot of interest in continuing to study it. Echinacea appears to be able to reduce the chance of you catching the common cold, but it doesn't necessarily shorten the duration. And there's a lot of studies on turmeric and curcumin and reducing inflammation. Some of those studies are still kind of not entirely conclusive at this time, although anecdotally, I've heard a lot of people benefit from those supplements in terms of their joint health. So it's a little bit hard to say in terms of how effective these are from the standard research out there. Also related to herbs is commonly thought of as this whole set of herbs called adaptogens, which has really become popularized lately. And those include things like ashwagandha is probably one of those most popular adaptogens, rhodiola rosea, and ginseng. And the concept is that these types of herbs help your body respond to stress. And while that concept is, kind of very easy to kind of understand and it has kind of a nice logic to it, there isn't actually a whole lot of evidence behind that concept, and that we're still trying to explore it and to study it better. There is some evidence that ashwagandha can improve sleep and anxiety, but it's really hard to say at this point. At this point, the party line is that it is inconclusive. Um, Herbal medicine, though, and especially actually for all these kind of camp therapies, research is actually very hard to do. It's very hard to actually get the highest quality research Because there's so many different variations in formulation and concentration. Also, these research studies tend to be much smaller than pharmaceutical studies, and they, of course, are actually less funded. There's lower funding available for this type of research because of the lower commercialization potential, the lower ability to be able to patent drugs because these are considered natural herbs, means that there is a gap in research here that is slowly being filled. But I do want to be clear is that, we might not have strong evidence for some of these practices, but that might not mean that they're ineffective. It just might mean that we haven't studied them away to really understand them. And at the end of the day, you really know your body the best. And so if you feel that some herb or some sort of therapy is helping you, that's really the best judge of these kind of practices. Going back to the list here, for mind body practices, there's actually a lot of research. There's been a lot of focus on understanding the impact of meditation, mindfulness practices, and the other mind body practices that I've talked about before, like the yoga, Tai Chi, and Qigong. Interestingly, meditation has actually been able to shown to reduce your blood pressure by quite a bit. It can reduce your top line blood pressure, the systolic blood pressure, by around 5 points, which is pretty significant. 5 to 10 point reduction is what's usually attributed to adding one blood pressure medication. So that's almost equivalent to adding a medication for blood pressure. And for diabetes, these mind body practices have been shown to improve A1C up to almost 1%. So that could mean bringing someone's A1C down from 7% to 6%, 8% to 7%. That can mean helping someone getting off of a medication, helping someone avoid starting insulin, really getting someone from that uncontrolled level to a controlled level of diabetes. So while it might not seem like you're doing much with the mind body practice, we are starting to see that it can have a significant impact on chronic conditions to the point where it's almost equivalent to really taking a drug. Aromatherapy has a lot less scientific evidence here, but the most well-studied ones include things like lavender, tea tree, eucalyptus, that kind of stuff. And usually the endpoints in the studies are anxiety, sleep, stress relief. And in homeopathy, as I mentioned below, there is one, not a lot of research, but also not a lot of demonstrative effectiveness. But the one homeopathy treatment that seems to be studied the most is actually arnica, which is often used for musculoskeletal pain. And it's usually, like I said, either it can be taken orally with like little sugar pellets, or in creams. And so, there's actually pretty low risk of trying a topical arnica. So if that's something you want to try, talk to your doctor about it. But that's kind of the one homeopathic treatment that seems to be studied the most as arnica. All right, so just quickly, before you kind of start your journey along exploring camp, here are some things to keep in mind. First, I've kind of mentioned this throughout the talk today, is that natural doesn't necessarily mean safe. And one of the best examples of this is ephedra or ma huang, which was a Chinese, it's an herb that's been used traditionally in Chinese medicine, also in some Indian medicine traditionally. But it was banned by the FDA in 2004 because it's a stimulant. It was used for weight loss, and coughs, cold, respiratory conditions, all sorts of things. But it is a stimulant and could cause heart attack, stroke, or even sudden death. So natural doesn't necessarily mean safe. Second, if you're interested in these, I know a lot of people want to try these without actually talking to their doctor, but the safest thing to do is actually talk to your doctor about these. Even if your doctor isn't super knowledgeable about them, you asking them about it can trigger them to do their own research and hopefully come back to you with a better answer if they off the bat aren't sure. So you want to ask your doctor, is this CAM treatment appropriate for your health condition? Remember, medicines have certain conditions they treat. CAM treatments are the same way. They have certain conditions that they treat. So is the therapy that you're interested in appropriate for the health condition that you want to target? Are there any medication interactions or potential side effects? Safety is especially important if you're pregnant or lactating. And lastly, perhaps your provider can actually give you a referral for someone that they trust for that type of treatment. Also, I mentioned before, we want to research your individual providers and check their credentials. As acupuncturists and chiropractors are licensed professionals. Also, massage therapists are licensed, so you want to make sure that they have the proper credentials and experience there. And as with Western medicine, you want to set your treatment goals. What are you trying to achieve? And what is your care plan? And monitor for progress. These are kind of best practices to make sure you're achieving what you want when you kind of start exploring these CAM options. So here are some resources to help you along the way. If you have any questions or want to work on your own health, our health and wellness clinics are there to serve you. And they also are more aware of your local resources that are in your communities. So those providers can potentially even point you in the right direction if you're looking for a specific type of CAM provider. You always have Teladoc available to you in case you want to ask them questions about your health or certain CAM treatments that you're interested in. And then here are a bunch of websites that are especially helpful. So let me call out the second bullet point under the National Center for Complementary Integrative Health. If you have any questions about herbs, that second bullet point, the Herbs at a Glance link, that is just so helpful because it summarizes a lot of the research that's been done on this specific herb, what we know about it, the safety, and different considerations. So out of all these websites, if you only want one to go to, definitely go to that Herbs at a Glance. But all these other websites are really helpful for more information. So I know I've thrown a lot at you. We've barely touched the surface on CAM, but we can go ahead and open it up to questions. You can either, I don't know if we can unmute you all, or you can go ahead and type in your question into the Q&A box, or if you can signal to us, raise your hand or something like that, and Jessica can unmute you. All right. It doesn't look, we'll give you another minute to think about any questions that might come up. But I just want to turn it back to Jessica in case there are any announcements you have.
Right, yes. And thank you, Rosemary, for the presentation. That was really awesome. Um, yeah, so our announcement is a save the date. Our next Health Chats will be on October 17th at 10 a.m. And the topic there is polycystic ovary syndrome, or PCOS. And the link to register is available already on our website. So if you go to unitedag.org/events, you can register there.
Great. Thank you.
Thanks. You have one question?
Oh, great. Yes, this is a great question. The question is it true that herbal medicines are not FDA approved, similar to supplements? That is largely true. They're not approved in the same way as drugs are. And so they're really only approved for general safety. And they're also not regulated as tightly as drugs are. So herbal medicines you can think of as the same type of regulatory control as supplements, which means that there could be quite a bit of variation between brands, even within an own brand. So you do have to be careful there. And the other question is, are these treatments covered under United Ag plans? That's a great question. I don't have the answer to that specifically. The best resource to ask is to call member services, and they can give you more information about the specific plan. Unless Jessica, if you have an answer for that.
Um, Not completely, but I do know there are certain ones covered like chiropractic care and I'm sure other things too. But member services would have specific details that would help out.
Great. Any other questions? No. All right, we will go ahead and end our health chats this morning then. Thank you all for joining me, and I look forward to seeing you all for our October health chats. Thanks so much, everyone.